I feel fine, I have no symptoms. Could I be immune to COVID-19? How can I find out if I'm immune? Can you?
Questions today, so I don't know how to even start on that one. No, I think this goes back to what we were talking about before with the antibody testing. If we can get a good antibody test that is reliable, that doesn't give false negatives, doesn't give false positives at a high rate, then we can start to find out if some people have either had the infection or have some kind of immunity to COVID-19, and those individuals would be protected. Where they would be able to go about their normal routines more readily. So that's kind of the gap in terms of figuring out if somebody has already had the infection. Obviously, some people have had the infection and tested positive, and we know those people have had it. We are hopeful that all those individuals would be immune going forward, but I think more needs to be studied about how long they might be immune and what their situation is.
Next one, it's sort of in that same theme coming in for Dr. Evans. If someone has recovered from COVID-19 and they're fine, can they pass it on?
Well, there is, as you're recovering from COVID-19 and you still have symptoms, you're infectious. But then at a certain point, when your symptoms have resolved and enough time has elapsed, and there's been some variability in that in terms of the guidance from the CDC, then the people that have gotten through that infection and they're completely recovered, those individuals are no longer going to be able to transmit the infection.
Okay, good. Okay, next one coming in, and this is trying to be preventive, I'm guessing. I don't have symptoms, feel fine. Should I get tested, though, before taking care of a senior citizen?
So at this point in time, there's not enough capacity to test the entire general population, especially those individuals who have no symptoms. At this moment, we just don't have the ability to do that. I think that there are situations I can imagine in the future where we would want to test some individuals before they interact with other people, and that might be one example. But we don't have the capacity for that.
Okay. Next one coming in, doctor, we have about 30 seconds looking for symptoms and signs. You may have something. Excessive sneezing. Is that a symptom at all, or it is allergy season?
Yeah, it's not the most common symptom. Certainly, it can be a symptom of having an upper respiratory infection. But the more common symptoms are cough, fever, tiredness, just fatigue, muscle aches, those kinds of things. Those have been much more common with COVID-19 than sneezing is. And yeah, it is challenging for people who have allergies, and I'm one of them. So when you have sneezing, you wonder, well, could that be something else? But if that's the only symptom you've got, that's pretty unlikely to be COVID-19.
All right. Dr. Brian Evans, thank you again for another visit. We do appreciate your time, and carry on, my friend. We'll see you again soon, hopefully.